Do you often feel out of sync with your body, experiencing unexplained changes in your mood, energy, weight, or skin? It could be a sign of something deeper than just a bad day or a poor diet. Today's topic is about what affects millions of women worldwide, yet is often overlooked or misunderstood: hormonal imbalance. Our body's hormones, which are produced by various glands and organs, play a crucial role in regulating many of our bodily functions, from metabolism to reproduction, and from mood to our immune system. When these hormones are out of balance, we experience a wide range of symptoms that can impact our daily life, relationships, and self-esteem. That's why it's important to know the signs of hormonal imbalance and how to address them proactively. In this video, we will walk you through the 12 most common signs of hormonal imbalance in women, based on scientific research and clinical practice. So without further delay, let's begin. Number 1. Continuous weight gain. Eating burgers and pasta doesn't necessarily lead to weight gain if you have a well-functioning metabolism and a regular exercise routine. However, if you have a hormonal imbalance, you may not see a difference in weight, even if you work very hard. This can be due to an imbalance in cortisol, the stress hormone, which can cause the body to store more fat than necessary. Unfortunately, this imbalance is very common and may be a reason why over 85% of previously obese individuals regain weight after losing it. So if you have used various weight loss methods without success, or if you have shed weight but regained it soon after discontinuing your diet or exercise regimen, then hormone imbalance may be a factor behind it. Before we move on, please take a moment to subscribe to the channel and hit the bell icon. If you find our videos helpful, please support us by becoming a patron. Number 2. Insomnia. Insomnia is not always linked to stress, anxiety, or other psychological issues. Sometimes the levels of melatonin and serotonin hormones, which are mainly responsible for controlling wakefulness, alertness, and positive moods, can also play a significant role in causing insomnia. Girls are particularly susceptible to sleep disorders due to hormonal imbalances during development. If your hormone levels are imbalanced, you may experience sleepless nights without actually understanding the underlying cause. Instead of resorting to pills and sedatives, it's best to take steps to improve your melatonin and serotonin levels and achieve restful, uninterrupted sleep. To achieve these goals, you first need to consider two things: 1. Enjoy the daylight, and 2. Regular exercise and physical activity. Number 3. Excessive stress. Excessive stress can often lead to hormonal imbalances in women due to the cyclical nature of hormonal regulation. If you're feeling overly anxious or worried about something, your progesterone levels may decrease. This can deplete your serotonin reserves, which are mainly responsible for keeping you calm and contented. As your serotonin levels drop below the necessary level, your stress levels may rise, causing you to feel more anxious and worried. To address hormonal imbalances, it's essential to identify and treat your increasing stress levels. Medications that boost your serotonin levels can be beneficial in this regard. Number 4. Profuse sweating. Profuse sweating is a common experience for women going through menopause and usually happens due to low estrogen levels. However, young girls may also experience similar symptoms, which can be related to hormonal imbalances. You may be surprised to know that men may also suffer from excessive sweating when their bodies produce too much testosterone. So if that's the case with you too, then it's crucial to address hormonal imbalances and take medications that regulate these gender-specific hormones to manage excessive sweating. Don't mistake sweating for the weather or any other reason. It may indicate a more significant underlying issue. Number 5. Low sexual energy. Low libido can sometimes be due to hormonal imbalances in women. Although it's not always the cause, a significant increase in cortisol levels and a subsequent reduction in primary hormone levels can lead to a decrease in sexual energy. If you're experiencing a lack of interest in sexual activity, it may be due to hormonal imbalances. Restoring your sex hormones to optimal levels can be an effective solution to this issue, ensuring that you can feel more enthusiastic in bed. Low libido is a prevalent health problem today, and it's essential to address it promptly. Number 6. Exhaustion and fatigue. Exhaustion and fatigue are other common signs of hormonal imbalance in women. Yet many of them often mistake them for usual everyday tiredness or lack of sleep. When cortisol levels rise, the burden of stress can cause you to feel exhausted and fatigued frequently. Additionally, this increase in cortisol levels can reduce your adrenal hormones, lowering your energy and stamina. Therefore, it's essential to incorporate hormone-boosting remedies into your daily routine to restore hormonal balance and reduce fatigue. So don't ignore these symptoms of hormonal imbalance and seek medical attention to address any underlying issues that may be causing your exhaustion. Number 7. Eating disorders. The function of our thyroid hormone levels is closely related to metabolism. Any imbalances in this hormone can greatly affect the normal metabolic cycle. When you have abnormal levels of thyroid hormones, you may either develop intense cravings for snacks and food, even in the middle of the night, or lose your appetite and feel full after just a few bites. These symptoms indicate that your hormone levels have been disrupted, and it is essential to address them. Abnormal metabolism is not healthy for your body, and it is necessary to take corrective measures to restore the balance of hormones. Number 8. Digestive problems. Hormonal imbalances can cause problems in the digestive system, as various hormones are responsible for regulating digestion. Hormones like gastrin and secretin help with food assimilation, bile secretion, and preventing inflammation in the digestive tract. However, even minor imbalances or disruptions in their levels can lead to issues like stomach pain, acidity, flatulence, indigestion, and nausea. Rather than relying on quick fixes like pills or soda, it's important to address the root cause and seek medical attention to balance hormones and ensure normal digestion. Number 9. Depression. Sometimes, hormonal imbalances in women can also show up in the symptoms of depression. While there is ongoing research to determine the exact relationship between hormonal systems and psychiatric disorders, it has been observed that low levels of adrenaline and serotonin, along with a high level of cortisol, can lead to feelings of exhaustion and nervousness. This can lead to severe depression and stress, which in turn can cause further health complications. It is important to address any hormonal imbalances and seek professional help if experiencing symptoms of depression. Number 10. Hair loss. Hair loss is a common issue that many people face, and it can be attributed to various factors, including hormonal imbalances. In women, high levels of testosterone and low levels of estrogen can potentially cause hair loss. When these hormone levels are not in balance, the hair can become weak, vulnerable to damage, and lacking in nutrition and health, resulting in hair loss. Prolonged stress can also play a major role in hormonal imbalance in women. It can happen when cortisol levels are too high for a long time, such as during long-term or chronic stress. If you are experiencing hair loss, it is important not to ignore it, especially if you are consistently stressed. Instead, seek medical attention and hormonal regulation therapies to address the underlying imbalance. Number 11. Mood swings. Mood swings in women have been linked to hormonal imbalances, specifically fluctuations in the female sex hormone called estrogen. This hormone plays a crucial role in regulating neurotransmitters in the brain, including serotonin, which is known to boost mood. Any significant changes or imbalances in estrogen levels can lead to a range of mood-related symptoms, such as premenstrual syndrome and depressed mood during perimenopause and menopause. In some women, hormonal imbalances can also cause irritability, anxiety, and other emotional disturbances. Therefore, maintaining a healthy balance of hormones is essential for overall emotional and physical well-being in women. Number 12. Skin problems. Hormonal imbalances in women often affect the health and appearance of the skin. In fact, this is one of the most common signs of hormonal imbalance in women. If there are high androgen levels in women, it can lead to the production of excess oil in the skin, leading to clogged pores and acne breakouts. Similarly, low levels of estrogen and progesterone can also cause an increase in androgen hormones and contribute to the development of chronic acne. Polycystic ovary syndrome is a condition characterized by an imbalance of sex hormones that can cause acne, excess hair growth, and other symptoms. During pregnancy, high estrogen levels can cause the skin to become sensitive and itchy. On the other hand, too low estrogen levels during menopause can cause itching and dryness on the skin. If you are experiencing persistent skin problems that you suspect may be caused by a hormonal imbalance, seeking the help of a women's health expert is very important to help you treat these signs and symptoms of hormonal imbalance. Thank you for watching and subscribing to the channel. See you in the next video.